It's time for our weekly partnership with Asante. This week, Asante's health expert Beth talks with Holly Nickerson about COVID boosters and whether or not they're worth it.
With masking requirements lifted in most places, people have a false sense of security that the risk of COVID-19 is over. But the CDC still recommends that all people get their COVID vaccines as well as the age-appropriate boosters. Holly, what are the age-appropriate boosters and why are they necessary?
Yeah, COVID-19 vaccines are recommended for everyone ages 6 months and older. The CDC recommends staying up to date with COVID-19, and up to date means when someone receives their primary series of vaccination, that's Moderna, Pfizer, and Novavax, the 2 doses, or Johnson & Johnson 1 dose, and then receives an additional dose to boost immunity and support continued protection. People ages 12 years and older are recommended to receive 1 age-appropriate bivalent, meaning it contains updated strains of the COVID-19 virus circulating, mRNA vaccine.
Are there different recommendations for people who are severely immunocompromised?
Before the introduction of the bivalent vaccines, there were some different call-outs for recommendations for immunocompromised individuals to receive additional doses. Now the recommendations are the same. Stay up to date with COVID-19 booster shots.
And do people who have had that COVID-19 infection still need to get booster shots?
Yes, there's growing evidence that suggests that vaccination following COVID-19 infection further increases protection from subsequent infection and hospitalization. You will want to wait until your symptoms from COVID-19 have resolved, and of course, check with your primary care provider.
How do people know when to get their booster shot? Like if they haven't had the infection, how do they know when to go in for a booster shot?
The new bivalent booster shot should be given at least 2 months after the completion of a primary series or an additional dose for individuals ages 12 and older.
So don't be lulled into that false sense of security that the risk of COVID-19 is over. Be sure to get your vaccinations and be sure to get those boosters. Thank you, Holly.
Thanks.